Pregnancy is not just a physical phase, but also an emotional and psychological journey where a woman nurtures a life inside her. One of the most common and often unspoken questions that many couples ask is it safe to have sex during pregnancy? Medically speaking, the answer depends on the specific condition of the pregnancy. In a healthy, low-risk pregnancy, where there are no complications like placenta previa, unexplained bleeding, preterm labor history, or cervical incompetence, sexual activity is generally considered safe. During the first trimester, hormonal shifts, fatigue, and morning sickness can reduce the woman's desire. But from a clinical perspective, intercourse is not harmful if done gently and with care. As the pregnancy progresses into the second trimester, it's often called the honeymoon phase, many women regain energy and feel more emotionally and physically inclined toward intimacy. This trimester is typically the safest and most comfortable time for sexual activity. However, it's crucial to avoid positions that put pressure on the abdomen. Side-lying or woman-on-top positions are often recommended. As the body enters the third trimester, physical discomfort, back pain, and emotional stress increase. While sex is still not harmful for most, caution becomes even more important. The uterus is more sensitive. An orgasm may trigger mild, temporary contractions known as Braxton Hicks, which are not dangerous but can be uncomfortable. It's essential that if a woman experiences any pain, bleeding, fluid leakage, or unusual symptoms, she should immediately consult her doctor. A very common myth is that intercourse can harm the baby. This is not true. The baby is well protected inside the amniotic sac, surrounded by strong uterine muscles, and further sealed by the cervix, which remains closed with a mucus plug that blocks out infection. That said, if a woman is diagnosed with high-risk pregnancy, sex should be avoided based on the doctor's advice. Every couple should understand that intimacy during pregnancy is not just about physical pleasure, but emotional connection and mutual respect. Open communication is key. If the woman feels scared, anxious, or uncomfortable, it should be discussed honestly with the partner and even with a healthcare provider. Some specific situations, like placenta previa, ruptured membranes, untreated sexually transmitted infections, make intercourse strictly unsafe, and in such cases, doctors usually advise abstinence until delivery. For couples still wishing to stay close, there are many alternative forms of intimacy that don't involve penetration, including cuddling, light massages, and emotional bonding. Doctors also recommend using condoms if there's any risk of infection, or if the male partner has multiple sexual contacts. It's also vital to note that sex during pregnancy must never be forced or done under emotional pressure. It should be mutually comfortable. Hormonal changes during pregnancy may affect the woman's libido, mood, and body image. Partners should be especially patient and understanding during this time. Consulting a gynecologist can help couples feel more confident and educated about what's safe. In today's world, there are many online medical resources and tools to help identify red flags and understand personal risks. In essence, sex during pregnancy is not forbidden, but it must be guided by awareness, care, and medical clearance if needed. Understanding each stage of pregnancy and adjusting intimacy accordingly helps strengthen the relationship and protects both the mother and the developing baby. A loving, informed approach ensures that this beautiful journey toward parenthood remains emotionally fulfilling and physically safe. The bottom line is, with the right precautions and open communication, sex can be a healthy and bonding part of pregnancy, but when in doubt, always choose to ask your doctor rather than guess. After all, it's not just about pleasure. It's about responsibility, love, and protecting the miracle growing inside.